Meaningful use reminders in Welford chart notes. Today we are going to learn about the 4 different ways to get credit for meaningful use for reminding a patient. The 4 different ways are by using rule reminders, appointment letters and postcards, and recalls. As long as the patient receives any one of these types of reminders during the reporting period, the patient is counted as having received a meaningful use reminder. Lastly, we'll see how to run the meaningful use report to identify patients who are in need of reminders and generate reminders for those in need. Part 1. Rule reminders. Rule reminders are logical statements that remind you to perform recommended activities for best practices. The program comes with libraries of them, and you can write your own as well. Press Libraries, Rule Reminders, Edit. If you haven't previously written any rule reminders, first press Rebuild, then Import, and choose a rule reminder library to import into your list. Highlight a rule reminder for which you will be scanning your practice for non-adherent patients. Press Scan. Send the results to the screen. Use the brief report type. Make sure you check Print Reminder Letter or Postcard. Make sure you have set up a reminder text file to use as the template for the letter or postcard. Then press OK. The program scans the practice for all patients who are in violation of the rule. Press OK to print the reminder letters or postcards. Click Log to see a record of who has received rule reminder letters and postcards. The Meaningful Use Report consults this log when deciding whether a patient has received one of these. Double-click a date to see what rule reminder generated letters and postcards on that date, along with a list of the names of the patients who received them. Part 2. Reminders. Reminders are specific procedures, tests, or other activities you told the patient to do, not generated by a rule. To add a reminder, press View, Reminders, Add. Enter the date and time reminded if different from the default of the current date and time. Click on Patient to enter the name of the patient. For Reminded to Do What, you can enter the name of a test or procedure recognized by the vocabulary system, and can press Search to choose terms that match the letters you enter, or type anything else you wish to remind the patient about. Optionally enter a date by which this test or procedure is due to be performed. You can later see all patients who failed to perform these reminded procedures by the due date. Specify the method by which you reminded the patient. Select Future if you only want to have this pop up in the future to remind yourself to tell the patient to do something. Every method except Future counts toward meaningful use because the other methods imply that you reminded the patient at this time. Specify who was reminded if different from the default of the patient, such as a family member. If you specified something recognized in the lab book vocabulary in Reminded to Do What, the type is automatically filled in for you as Test. If you specify something else, such as a referral, then choose its associated type. The default resolution for a new reminder is Pending. This is automatically changed to Performed if the test listed in the Reminded to Do What later gets stored in the lab book. You can also go back at any time and change the resolution to something else, such as Performed or Canceled. Enter an optional comment and press OK to store this new reminder. Part 3. Appointment Letters and Postcards. You can generate letters or postcards to your patients reminding them of their upcoming appointments. To do this, press View, Appointments, Report. Give your report a name so that you can run it again in the future. Specify the earliest and latest dates of appointments to include in the report. These dates should be in the future because your goal is to identify patients with upcoming appointments. You can add or remove names of providers from the list of those whose patients you wish to include in the report. Check Pending to identify patients who have an upcoming appointment. Click Print, then choose Letters or Postcards depending on which you wish to generate. You can see a log of when each patient has been sent an appointment letter or postcard by pressing Print Log. The Meaningful Use Report consults this log when determining whether a patient has had this type of reminder. Part 4. Recalls. Recalls are generated when a patient has not returned for a visit after the return interval specified in the last visit. For example, if your last visit says to return in 3 months, and more than 3 months have now elapsed without the patient returning for a visit, a recall can be generated to remind the patient to schedule a visit. To generate recalls, press Reports, Recalls. Press Scan to identify all of the patients in your practice who are overdue for visits. You can use the default settings or adjust them to fit your needs. Press OK to run the scan and see a list of all of the patients who are overdue for visits. If you want to tweak the list of names before printing them, press Edit. Press Print to print the letters and postcards. You can change any of these default settings if you wish. Press OK to print the letters or postcards. The log shows you when each patient has received a recall letter or postcard. The Meaningful Use Report consults this log in determining whether a patient has received this type of reminder. Part 5. Meaningful Use Report. Now let's see how all of these types of reminders feed into the Meaningful Use Report. To open the report, press Reports, Meaningful Use, Measure Report. Here we check Reminders to focus on this particular measure. Specify the start date and end date of the report. Click Providers if you want to limit the report to just certain providers. Click OK to run the report. To enhance the rate of compliance for a particular provider, click on that provider's measures line. Then click Fallouts. These are the patients who have had at least one visit with this provider between the begin and end dates of this report who have not had any of the 4 different types of reminders we have seen in this video. In order to bring the patient into compliance, you must now generate one of these 4 types of reminders for the patient. For example, highlight the patient's name and press Jump Reminders. This opens the Reminders window. Remind the patient of something that the patient will be due for in the future, and record that fact as a reminder. When you run the Meaningful Use Report again, this patient will now be shown to be in compliance with the reminder measure. And that's how to do meaningful use reminders in Welford Chart Notes. For more information, visit us at emirj.com.